Hello everyone, this is Dr. Hasna brought to you by UK Pass Academy, and today we're doing the subcutaneous injection teaching. So once again, let's go over the approach of teaching. I've already told you guys, and I've told you guys to always mention the first rapport, the 4 W's, and then the basics. So whenever you're getting started with the subcutaneous injection, make sure you have an idea of it, of what it is, so that you can teach it obviously. So you build a rapport, your student or anybody or a patient is here, they want to learn about it, you build a rapport, okay, how is it going? So if it's a student, you ask how your rotation's going, how's the exam going, how's everything, do you have need any help, I'm here for you, alright? Once your rapport is built, you go for the 4 W's. So you ask her, so what do you already know about subcutaneous injection, and what do you want? So what want, why, and when. So what do you want to learn, anything in particular, and when do we do it, do you know when we do it, and why, is there any particular reason why you're wanting to learn about it. So if we talk about the when do we do it, you should know. There are a couple of indications, especially when you have to put some medication that are going into the skin. So subcutaneous injection is a skin injection. So when do we do it? Mostly for insulin, for low molecular weight heparin, for palliative medicines. We have to give these injections by skin. That's why we go for the subcutaneous route. So always begin after 4 W's, you go for the basics. So alright, thank you John for telling me everything you know. Now let's talk about the subcutaneous injection. First things first, subcutaneous injection, what does it mean? Okay, the basics. It means that we are putting an injection in the skin, just like we have IV for the vein, we have IM for the muscle. This subcutaneous injection, it is for the skin. All right, are you following me, John? Okay, and then you just tell him, do you know which medications we put through skin? And then you verbalize the ones that I just stated. Okay, next, John, what you're going to do, always before you approach the patient, or you have to do it to yourself, always make sure you check. The most important thing in a subcutaneous injection is the checking the rightness of everything. Is it the right medication you're giving? Is it the right dose you're giving? And mostly, is it the right patient you are giving it to? Okay, confirm the details of patient, confirm right dose, right medicine, make sure you document it, and then you have to make sure everything is checked. Okay, right prescription, everything should be checked. Make sure you tell this to the student sitting in front of you. Next, what you're going to do, once again, you're going to explain the procedure, the E square, C square, P square. I'm going to take the consent, explain, I'm going to talk about the privacy, the chaperone, I will talk about the exposure and position. Coming to exposure, if we talk about, so there are various sites for subcutaneous injection. You can ask John, would you like to, think of a site for me? Where do you think we put subcutaneous injection? Try to involve the student, okay? If he doesn't know, you can say, it's okay, I will tell you. We can put it on the upper outer arm. We can put it around the upper thigh, in the upper buttock. Basically, we're targeting areas with more fat so that we are not going into the veins or deeper tissue. That's why we keep it to the skin. And most importantly, we have the tummy. Now, the tummy rule is that, John, just remember one thing when it comes to tummy is that try to not avoid injecting in 2-inch radius around the umbilicus. Okay, so it's like a circumference 2 inches. Outside of that, try to put the injection. Make sure you've told him all of these prerequisites, and then you proceed to tell him what to do. Firstly, John, of course, you're going to wear your gloves. So assume I have gloved. Okay, then you collect your equipment, John. So here is the equipment. Basically, you're going to collect the alcohol swab and a gauze. So by default, for all procedures, anything you're about to do, by default, remember your alcohol pad and your gauze are your best friends. Okay, this is the pre and this is the post. All right, next obviously is the subcutaneous injection. This is pre-filled with the medicine. All right, but I want you to know, if it's not pre-filled with the medicine, then it will come with 2 needles. One will be the drawing needle, one will be the injecting needle. Drawing needles is the one that you will draw. This needle is drawing needle. You will first take alcohol swab, you will clean the top of the bottle, you will draw the medicine. Once medicine is in, you will throw on top the drawing needle in the dustbin, okay? Waste bin. Then you take your drawing needle and then you put it on top. Alright, everything will be covered, don't worry, you don't have to pick a needle, don't worry about that. So now suppose our injecting needle is on. So first you did the drawing needle, you threw it, then you took the injecting needle. If not, sometimes it comes with a pre-filled syringe. If you're lucky on that day, you'll get a pre-filled syringe. All right. So once you've done that, okay, now you have your medicine in check. You've done all your prerequisites. What you're going to do is you're going to take the site. As you can see, this is our site. what you're going to do, you're going to open the alcohol swab, and only once you're going to rub, you're going to throw it in the waste bin. Okay, just one rub. Don't make sure you're not rubbing it like that, because you're taking off the bacteria, throwing. If you do this and then go back, the bacteria is back on. Okay, so don't do that. So once you've done that, now quickly just do this, tap your medicine, any air bubbles, let them out. Done. Now you take off your cap, throw it in the dustbin. And what you need to do is you have to do the pinch method. You need to pinch the skin of that person. Pinching means you have to, like that. I hope you can see. So once you've pinched the skin at a normal angle, very easy. Okay, sharp scratch coming, John or Michael or whoever the patient is. Sharp scratch coming, just like that. Insert. No need to check for blood. Just directly inject the medicine. Once you've done with that, take your gauze piece, put it on top, take this out, throw it in the dustbin. Now, once your procedure is done, make sure what you're going to say to the patient is, all right, that's about it. So you can cover up. Thank you so much. Now you have to tell the post-procedure stuff. You have to tell him that make sure that this is going to be fine. Might remain sore, but it's completely normal. But if there's worsening pain at site, in 2 days, it's worsening, you come back to the hospital immediately. So you're safety netting him. And apart from that, the other things, other complications that can happen as a result of subcutaneous injection is maybe hematoma formation. Could be rarely anaphylaxis, but make sure you have told patient about it, made aware to him what the complications are. Now you're just going to cover, and just make sure maybe John might ask you this question, or maybe you have to tell him to always rotate the sites. Okay, it shouldn't always be same injection site. So if you put one day over here, put other day here. If you put it on the tummy, then rotate the tummy sites. Someday here. Never inject on a site which is already scarred or inflamed. Alright, so that's about it for subcutaneous injection. See you in the next video.